everyone, welcome to Module 4. So this week we actually have 2 chapters to discuss again, and that will be not the entire chapters, but still some very good content in those chapters. So we're looking at Chapter 33, pages 705 to 721, and Chapter 38, pages 858 to 873. Chapter 33 will actually look at the female reproductive system, and Chapter 8 will talk about assisting with reproductive exams and urological specialists. So let's go ahead and get started. So Chapter 3 again is talking about the female reproductive system and the organs that it actually encompasses. Those organs consist of the primary sex organs, the ovaries, and the accessory sex glands, such as your uterus, fallopian tube, vagina, vulva, and breasts. So let's take a look at each one of those organs. We're going to start with the ovaries. Now the ovaries you have 2 of them as females, and they're part of the female reproductive system. They are located on either side of the uterus, and the ovaries look very similar to almonds. They have a very rounded shape to them. And your ovaries themselves have 2 main functions. The first function is to provide ova or eggs for fertilization, and then they also produce your hormones. Next organ we have is your uterus, and that is a hollow, pear-shaped organ. It's located in the front of the pelvic cavity, right above the bladder, and your uterus has 3 main functions to it. So once a month, your uterus will go through what we call menstruation, and it will actually have a discharge of blood and then uterus lining. Your uterus also provides nourishment and protection for a baby during pregnancy. And then subsequently, during labor, that uterus will help you contract to actually birth your baby. Next organ we're going to talk about is the fallopian tubes. These fallopian tubes actually extend from each side of the uterus and bend inward toward your ovaries. They will actually provide a functionality to move the egg from the ovary to the uterus for fertilization. Each fallopian tube is about 4.5 inches long and 1/4 inch wide, so it's not very big. Next organ that we're going to look at is the vagina. This is a tube that consists of muscles and membranes. The vagina actually extends from the uterus and is typically about 4 to 6 inches long. Now the vagina does have 3 main functions that it carries out. First, it's the female organ for copulation, or reproduction. It is the passageway for that discharge of menstruation, and it's the passageway for birth of children during labor. The vulva is the next sex organ that we're going to look at, and this is actually made up of 5 different organs. So the vulva is actually the outside external part of the female reproductive system. It contains the mons pubis, the labia majora, the labia minor, the vestibule, and the clitoris. And the last organ that we're going to take a look at is the breasts. Now these are rounded structures made out of fatty tissue that protrude from a woman's chest. Each breast has numerous glands that form 12 to 15 different tissue lobes. The areola is the dark pigmented circular area of the skin found on each breast. And within the middle of each areola, we have the nipple or the elevated area in the center. Alright, we're going to switch gears here. We're going to now talk about Chapter 38. And Chapter 38 is talking about gynecology, which is the branch of medicine that deals with disorders and diseases of the female reproductive system. anytime an exam for a female reproductive system happens, it will include a breast exam and a pelvic exam. The breast exam will help to detect any breast cancer or abnormalities. Patients will lie on their backs with one hand behind their head at a time. What this does is it allows the physician to examine the lymph nodes under the armpit. Providers also suggest to patients that starting around age 20, they start doing breast self-exams, or BSEs. These should be performed every month about 1 week after the menstrual cycle, and any time that they notice some sort of abnormality, it should be reported to the provider right away. During a pelvic exam, you're going to have both an internal and an external exam. Generally, your internal exam is called a pap smear, and this is going to help to diagnose any cervical cancer or HPV, human papillomavirus. And the external will actually look for any sort of genital warts or abnormalities. As medical assistants working in this area, we can see a very wide range of patients. It could be a first-time patient with a pap smear. It could be a first-time pregnancy. It could be a high-risk pregnancy. You never know what could come in that office, so always make sure that you're identifying and helping to figure out what the patient's problems are so that way the provider can be as prepared as possible going into that exam room. You'll also be part of different exams. Maybe it's a first-time pap. Maybe it's a newly pregnant patient. So all those different exams will help to explain problems that are happening or things that the patient will go through. And that will be your responsibility to actually provide the patient with instructions and make sure that they're prepared for what's going to be happening. Alright guys, that is where I'm going to stop this week's video. Please make sure, as always, that you read your chapters in full, as that will help you be prepared for your discussion post and quiz, but also because it will help you with this week's lab that you will be attending. For your discussion post this week, what we're talking about is high-risk pregnancies, and does age really matter? So you're going to start off this discussion post talking about why contraception after a certain age is considered high risk, and why it becomes a higher risk the older that a patient becomes. You'll need to complete your initial discussion post Tuesday by midnight, and you'll have to have 2 responses to classmates completed Saturday by midnight. Also this week you do have your quiz over the female reproductive system. This is a 10-question multiple choice quiz. You will have a 10-minute time limit. And as this is an online quiz, it will be due Sunday by midnight. Now the last thing I want to talk about in the video this week is when you look at your Angel platform, you will see that there is a mid-quarter eval. I really would appreciate it, and I know Rasmussen and all the people who work at Rasmussen really would appreciate it if you could give us your opinions and feedback. They do matter to us, and we do use them to help us create new courses and to maybe change or alter courses along the way. It won't take you very long. It'll take just a few minutes, and all submissions are anonymous. I don't know who says what, so please give your honest feedback. It means a lot to me and to Rasmussen as a college as a whole. So hopefully you will take some time to do that for me and for the college. And any questions that you have, guys, please make sure you bring them forward in an email or a phone call, and I will help you as best as I can. Have a wonderful week, everyone, and I will see you next week. Bye, guys.